December 6, 2017, I went to the doctor with pain in my back. After a handful of x-rays, I was given a diagnosis. It was scoliosis. While it was a shock, it was time to start thinking about what to do next. I know from my audience analysis, some of you may know someone who has had experience with scoliosis. Some of you might not be the most comfortable with this subject, but sadly enough, it's something prevalent throughout the world. I feel as if I'm able to tell you about this as it's something that I've dealt with and done research on. Scoliosis not only affects the diagnosed person, but the family, friends, and people around them as well. Today, I will inform you on what scoliosis is, my experience with scoliosis, and the scoliosis treatment options. Let's begin with finding out a little bit more about what scoliosis is. According to Merriam-Webster's Medical Dictionary, it states that the definition of scoliosis is a lateral curvature of the spine. There's little known about the history of scoliosis. According to Historical Overview of Spinal Deformities in Ancient Greece, Hippocrates had introduced the term scoliosis and kyphosis when he wrote more about kyphosis rather than scoliosis. According to Johns Hopkins Medical Study, roughly 3 million new cases of the condition are diagnosed in the United States each year. With this being said, many cases are diagnosed as idiopathic adolescent scoliosis. Idiopathic meaning that it's not sure what the cause is. While so many cases are prevalent, most of the causes are unknown. Now that I've given you an overview of what scoliosis is, I want to tell you about my experience. On December 6, 2017, I went to the doctor with back pain. The doctor performed many physical exams and x-rays. When I came back from x-rays, the doctor gave me the diagnosis of scoliosis. With little knowledge on the subject, I was overwhelmed with emotions, fear, confusion, worry. I was referred to a doctor at Children's Mercy Hospital in Kansas City, Missouri. According to Children's Mercy Hospital website 2018, their mission is to improve the health and well-being of children by providing comprehensive family-centered health care, committing to the highest level of clinical and psychological care, and exhibiting research, educational, and service excellence. I had an extensive amount of appointments to find out what the next step was. I decided to have spinal fusion surgery. On April 24, 2018, I made a trip up to Children's Mercy for surgery. After undergoing the surgery, I'm still recovering from it today. Now that I have told you about my experience with it, I will share the treatment process. As stated in I've Got Your Back by Nathaniel Tyndall, MD, there are 3 main types of treatment. 3 main types are observation, bracing, and spinal fusion. Observation treatment is a steady 6-month checkup with x-rays to follow the progression of your scoliosis. While many don't believe observation treatment is useful, it is. It allows doctors to make choices as to the next recommendation for the step in the care plan. Bracing, according to a 2013 journal with the Scoliosis Research Society, the main goal of bracing is to slow down and limit a chance for progression with the curve. SRS found that of patients randomly assigned to wear a brace, 75% had curves that did not progress to the 50-degree threshold for surgery at skeletal maturity. This is often common for younger patients or patients with low spinal curves. The last is spinal fusion. As stated in Merriam-Webster's Medical Dictionary, spinal fusion is the surgical fusion of 2 or more vertebrae for remedial immobilization of the spine. According to a 2018 American Academy of Orthopedic Surgeons article titled Spinal Fusion, a bone graft is done to place small pieces of bone into the spaces for the vertebrae for the fusion process. After a mobilization process, surgeons often use plates, screws, and rods to stabilize the spine. Although it's risky, it's often effective. While all these methods can be beneficial, it depends solely on the personal preference and the extent of the diagnosis. Today, I have provided you with information about what scoliosis is, my experience with it, and the treatment options. With information provided, I hope it allows you to have a better understanding of what it is, and I hope that you can pass this on to a person in need. Scoliosis is prevalent throughout the world. Regardless of who you are susceptible to it. Always be thoughtful of others because you never know what the person sitting next to you is going through. Thank you.